You're welcome to do that again with ice in a sandwich bag. If you have ice packs, you can use those. The other thing that works really well is frozen peas, frozen corn, frozen veggies work really well. You just want to make sure that every once in a while you check them and make sure they're still frozen, because if they're not frozen anymore, they're just...
do any good.
Peas don't really work on their own. It's the frozen part that's helping, right? So just as long as she keeps something kind of frozen on there today. Tomorrow, when she's kind of more up and around, if you start to see a little swelling, ice will help too. But lots of ice today is where we're really going to see the biggest, preventative on the swelling and bruising. She might still have, swelling anyway, but it helps decrease it a lot, okay?
All right.
Starting tomorrow, she's going to do saltwater rinses, and she's going to do those for a week. She'll do them 4 times a day. Well, you can adjust the salt water to taste. It doesn't really have to be a lot. You can adjust it so that it's not, it's not that much. It says a pinch of salt to a cup of warm water. And
A pinch of salt?
a pinch of salt to a cup of warm water. And it doesn't, the exact amount really isn't as important as just having warm, salty water. That's what we're really looking for. That's right, warm, salty water. Any kind of food salt is fine. Table salt, sea salt, kosher salt, as long as it's a food salt. There are some salts like Epsom salt that aren't food salts, and we don't want you to use those, but food salts, any of those. And then a suggestion for the 4 times is after meals and before bedtime. That way you're hitting it 4 times a day, and you know when you've done it. But it's not, that's right, exactly. But it is not essential to do it then, and it also isn't prescribed then, and we want you to know that. If that doesn't work for her schedule, if she can't take salt water to school or whatever, that's perfectly fine, as long as she's doing it 4 times a day. That's just what we're worried about. For 1 week, starting tomorrow. Starting tomorrow, she'll do it for 1 week. And then about that time, she'll be coming back for her follow-up, so we'll talk to you about the other rinsing that we want you to do then, but you won't worry about that until you come back, okay? As far as pain management, now that depends on how she's feeling, because since she's kind of wearing off from all those medications, if she's still pretty numb and she's not hurting, I would recommend that you just kind of do something over the counter, because she's still kind of in left field, and if we give her a narcotic right away, it's going to put her right back out there. Do you know what I mean? Now, but pain management is much more important. So if she's starting to get achy and she's starting to hurt right away, you want to treat the pain, and that's more important. So you could give her the prescription, the Lortab, right away, if she needed it for pain. So we don't want you to withhold it because you're kind of trying, because you're not wanting to give her something too strong if she's really hurting, because it's more important to treat the pain. But if she feels okay, if she's still numb and she feels fine, she says it doesn't hurt at all, try and do an over-the-counter first. You can take up to 3 if it's regular strength, Tylenol or ibuprofen. Those regular strength is 200 milligrams, so you can take up to the 600. If your bottle, in 4 hours, you can take up to 3 in 4 hours. If your bottle says extra strength, it's probably 500 or 600 milligrams already, so we don't want you to take more than the 1 dose of that. But if it's regular strength, up to the 3. There's no recommendation as to whether we want Tylenol or ibuprofen for that. It really just depends on what works better for her. It works differently for every person, and sometimes one of those will work better. If you are taking Tylenol, it's perfectly fine. If that's what works the best for you, that's great. But you need to remember that there is the Tylenol in your prescription, right? And so we can't let them overlap. Because in the overlapping time, you would end up with too high a dose of Tylenol. Because then you'd have, both doses of Tylenol together at once. If you use ibuprofen, which is Advil, the name brand of that is the Advil, you don't need to worry about that because they are separate medications and they don't interact that way. So that's just something to think about. But if that works okay for you, that's what I recommend if it works well for you. If it doesn't work as well, then there's not really any point because it's not helping as much. But, so then it is your shirt, and you're going to put it on in just a minute, okay? We're going to change your gauze first, and then you get to put it on. I don't want to get anything on your pretty shirt. So, if you take the over-the-counter and then 2 hours later she decides that it's starting to ache and she really wants the prescription, you can take it right away then. You want to make sure, though, if you end up overlapping them at all, that's fine to do, but just write down what you took and at what time, because most of them are usually each 4 hours. And that can get really confusing because you can be thinking, okay, 2 o'clock I can take something, but which one was it? And since the one's a narcotic, we want to be real careful with it. So write down. That's right. As far as your diet, you're going to have clear fluids first. Do you like Sprite?
No.
Do you like Fanta? I think it's kind of clear. Anyways, water. Water, good deal. So water. So you're going to try some water or whatever clear fluid she feels like and wait 10 to 15 minutes. That's not because of the teeth. It's because nausea can be a side effect of one of the anesthetics used. It's not common, but it's normal. Okay, so if it happens, it's nothing to worry about. But, Yeah, like I said, it isn't common, but we just want to make sure that's correct. And we want to see how she's going to do before you just start to like load a lot of food in. So that's why we want to do a clear fluid first, because that'll put something in her stomach and get it digesting, and you'll kind of get an idea of how she's going to feel from that. Right. If it starts to make her feel like, whoa, she's not really feeling, it starts to make her feel a little nauseous, have her lay down and just kind of take sips of those clear fluids until she feels better. If she has the fluids and she feels fine, she's feeling great, then she can have something to eat. Now we do want her to stick to a lot of fluids because of just the bleeding and everything. Lots of fluids today, and pretty easy stuff at first. You don't want to just go right into a big bowl of mashed potatoes, but do like a milkshake as long as you don't use the Strawberry or Jello. Ice cream would be perfect. Ice cream, applesauce, stuff like that. And then as the day goes on, she's feeling better, kind of getting back into things. She could do more like mashed potatoes, mac and cheese, pastas. That's right. Real soft, mushy stuff today. For 24 hours, we want her to really stick to the soft, mushy foods. And then starting tomorrow, she can be back to normal foods. I think we've got that under control. They're going to have a little side deal going on with the tooth fairy, I think.
Is this normal?
Yeah. Oh,
Girls
yeah.
like this?
Absolutely. Girls
they
are
had to
very
crush
emotional.
it
Yes.
to get it out.
Yeah.
She won't remember that.
No, she won't. She won't usually. So, when you nothing hard or crunchy. Okay, obviously soft foods. You don't want to do anything hot while she's still numb, because she won't feel it. So stick to the colder room temperature stuff till the numbness wears off. And she can have, because of the medicines. Well, that won't be till tomorrow that you start that. But colder room temperature stuff, nothing spicy. That's really going to irritate those areas. So don't put any hot sauce on anything. Maddie, we're going to change your gauze and then we're going to get you home, okay? And you can have your ice cream. Sound like a plan? What?
Don't worry about it.
I'm worried about getting you your ice cream. I think that's more important. Ice cream.
Madeline, that's not your problem, honey. How about a tooth fairy?
Maddie, what kind of ice cream do you like? What's your favorite kind?
I don't know. Well, come on, what kind?
Favorite kind of ice cream?
You do too. What's my favorite?
Probably
How about
cookie
cookies
dough.
and cream?
Yeah.
I like cookie dough. Chocolate? Ew, vanilla. Vanilla. All right.
Vanilla?
Okay, so Mom, you are fine to stay close. I just want you to come here, okay, so that I can be kind of in your way. So the gauze is going to come out in squares like this. You're going to moisten it with cold tap water. And you want to squeeze it out so it's just damp. You don't want it to be soaked. Okay. So I turn on the tap, let it run a little bit, run it under there real quick, and then squeeze it out. So we've got it nice and damp. You want to fold this in half. So you've got this long piece. Fold it in thirds. And then fold it in half one more time. So we did half, thirds, and half. It makes like a hot dog bun. That's how I remember. Good. You could have hot dogs tonight too. Okay. Half, thirds, and halves. Gotcha. Half, thirds, halves. Like that. So what we're gonna do, my dear?
It's okay, let it.
Can you open your mouth for me real big? Perfect. Oh, you're doing so good. You don't have to look at it. You don't have to worry about it. So you've got the red, and that's what we're talking about with the active bleeding. But when you're seeing this light pink here, you don't need to worry about using the gauze anymore. Then that's when you're done. When you're just seeing that light pink.
Don't put your fingers in your mouth.
And
You're doing great.
okay. So what you're going to do is you're going to put the gauze straight back in the mouth. You want to tuck the ends in the holes where the teeth are, so that you've got one hole on each side. Then the rest of this excess gets tucked in between the teeth and the cheek. I'll show you. Okay, open big for us. As big as you can. Perfect, sweetheart. You're doing good. Oh, please don't talk while I have my finger in your mouth. I like to keep my fingers. So see how we're in the hole there? It's back in there, and then the rest of it's tucked on the side in between her teeth and her cheek.
Okay.
All right.
The hole where your teeth were. Okay, open it real big. Maddie, real big for me, okay? This part's important. I know, but I need you to not talk while I'm doing this, just to keep my fingers. Same thing. See, we're back in there, and then the rest of it's on the side in between the teeth and her cheek.
Right.
Okay, done.
You look like a chipmunk. It's okay. You look like a cute chipmunk. Chipmunks are ugly.
No. Maddie, I think think you're awful cute. That's what I think. So we're going to put the instructions in here so you have everything all together, guys. And we are all done. So what I'm going to have you do is get the car, bring it to the front of the building here. When you come out of the elevator, there's 2 doors right at the front. That's the front of the hospital that's facing, oh, I'm sorry, the front of the building. Our other office is in a hospital. I'm used to saying that. The front of the building that's facing the hospital, St. Ian's. That door is where we're coming out. So when you come out the elevator, that main door right there.
Can I stay with her while he gets the car?
You know, if it makes you feel comfortable to stay with her, you can. I do it all day, so it's fine. But if you feel better, you're welcome to stay.
Is that what?
That's your lip.
That's your lower lip.
Your tongue's in your mouth.
You already saw it. That's your tongue.
Right there. You got it.
That's
Yep.
your tongue.
Go back in there? Okay. So, if you guys want to go ahead and do that, it's up to you. If you want to stay
All
Mom,
right.
it's okay with me.
Do you want me to stay or want me to just go and get the car?
She can stay. She doesn't have to go. She'll stay. So, Dad, you can go grab the car. Then we'll have you get your stuff.